Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about understanding fibromyalgia, a complex chronic pain syndrome. What is fibromyalgia? Fibromyalgia is a chronic syndrome characterized by widespread musculoskeletal pain. It's often accompanied by a constellation of other debilitating symptoms, making it a complex condition to live with and diagnose. It was first described in the 19th century with the concept of a pain syndrome without specific organic disease emerging in the 1950s. The term fibromyalgia and tender points were coined in the 1970s, 80s. It is estimated that 2 to 8% of the world population is affected by fibromyalgia. Fibromyalgia is significantly more common in women than in men. Reasons for higher incidence in women may include higher levels of anxiety and depression, altered pain responses, central nervous system input differences, and hormonal effects related to the menstrual cycle. Age of onset. The typical age range for fibromyalgia onset is 30 and 35 years. Trigger factors. Symptoms often begin after physical or emotional trauma, but in many cases, there is no obvious trigger. The exact cause of fibromyalgia is still being researched, but it's understood as a pain processing problem in the brain leading to hypersensitivity. Central sensitization. This is a key mechanism where the central nervous system, brain, and spinal cord amplifies pain signals. Patients experience lower pain threshold, feeling pain from stimuli that wouldn't normally cause it. Hyperalgesia. This is increased pain from a painful stimulus. Allodynia, pain from a stimulus that is not normally painful. For example, light touch. Neurotransmitter dysregulation. Elevated excitatory neurotransmitters such as glutamate and substance P. Decreased inhibitory neurotransmitters like serotonin and norepinephrine in pain modulating pathways. Dopamine dysregulation and altered endogenous opioids also contribute. Beyond central sensitization, other factors are implicated. Peripheral abnormalities. While central mechanisms are primarily peripheral nerve changes and increased activity of C fibers may contribute to increased nociceptive input to the spinal cord. Inflammation and immunity. Evidence suggests neurogenic inflammation with increased circulating inflammatory cytokines, for instance, interleukin 6, interleukin 8, TNF alpha, and activation of immune cells. Studies show a potential involvement of genetic factors with a correlation rate of 50% between genetic variants and chronic pain development. Genes related to serotonin, dopamine, opioid receptors, and pain sensitivity are under investigation. Endocrine factors, dysregulation of the hypothalamic pituitary adrenal axis, and lower levels of growth hormone are often observed. Psychopathological factors and poor sleep. There's a high prevalence of anxiety and depression, up to 60% in some subpopulations, significantly impacts pain severity. Sleep disturbances can precede and exacerbate pain and mood alterations, creating a bidirectional relationship. Symptoms of fibromyalgia. Fibromyalgia presents with a wide range of symptoms, often fluctuating in intensity. Chronic widespread musculoskeletal pain, the hallmark symptom, often described as a deep ache, burning, or throbbing. Pain is typically present in all four quadrants of the body. Fatigue, profound and persistent tiredness, often not relieved by rest. Sleep disturbances, insomnia, non-restorative sleep, and disturbed sleep architecture. Mood disorders, high rates of anxiety and depression. Cognitive dysfunction, fibrofog, problems with memory, concentration, and mental clarity. Muscle stiffness and joint stiffness, especially in the mornings or after periods of inactivity. General sensitivity, increased sensitivity to touch, temperature, light, and sound. Other associated symptoms, intestinal disorders, for example, irritable bowel syndrome, headaches, and interstitial cystitis. Diagnosis of fibromyalgia. Diagnosis is currently clinical based on a thorough evaluation by a rheumatologist. Historical criteria 1990. History of widespread pain, all four body quadrants for at least 3 months. Pain on digital pressure in at least 11 out of 18 specific tender points. Updated criteria 2010-2016 based on a widespread pain index, the number of painful body areas, a symptom severity scale including somatic and cognitive symptoms. The tender point exam remains important for a complete musculoskeletal assessment and to rule out other conditions. Fibromyalgia does not involve organic damage to joints or muscles. Biomarker research. Currently, no objective tests or biomarkers with sufficient diagnostic accuracy exist. Research is ongoing to identify genetic, epigenetic, and serological markers. For example, specific microRNAs, certain protein profiles, or changes in neurotransmitter levels like glutamate. Treatment. Conventional medical therapies often provide limited benefits and primarily target symptoms. A multidisciplinary approach is generally recommended. Pharmacological treatments, antidepressants, serotonin norepinephrine reuptake inhibitors or SNRIs, and tricyclics are often used to address pain, mood, and sleep. Gabapentinoids, for instance, pregabalin, can help reduce pain by modulating neurotransmitter activity. Pain relievers, non-steroidal anti-inflammatory drugs, are generally ineffective for fibromyalgia pain, highlighting its non-inflammatory nature. Complementary and alternative medicine. Statistics show that 90% of people with fibromyalgia also turn to complementary medicine to manage their symptoms. Antioxidants and diet. Fibromyalgia patients often have increased oxidative stress. Supplementation with antioxidants, for instance, coenzyme Q10, melatonin, vitamins D and E, and specific dietary approaches are being explored for their potential to reduce symptoms. Palmitoyl ethanolamide, an anti-inflammatory and analgesic lipid mediator showing promise in preclinical and clinical studies for pain and inflammation. Living with fibromyalgia, a multifaceted challenge. Fibromyalgia is a complex syndrome that significantly impacts a patient's quality of life and places an economic burden on healthcare systems. Ongoing research. Pathogenesis is still not fully understood, and research continues to identify objective diagnostic tools and more effective treatments. Personalized care. Given the varied mechanisms of pain sensitivity, effective treatment often involves multidisciplinary programs tailored to the individual, targeting peripheral, central, cognitive, emotional, and interpersonal aspects of chronic pain. Well, thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.